Hello again. In this video, we will talk about safety guidelines when working out. We will go over a list of things that you will need for this course, whether you will be working out at home or at the gym. Here's what you will need for working out at home. Slip-resistant sneakers, preferably with no laces, in order to avoid slipping, falling, and getting injured. Compression socks or stockings as a preventative measure against developing pain issues. Yoga mat is recommended, of course. Back support brace or belt in order to avoid injury in lumbar region. Resistant bands for the workouts, dumbbells, and ankle weights. For gym workouts, you will need slip-resistant gloves to get better grip when holding dumbbells and to prevent blisters. You will also need a back support brace or belt. Before every workout, we will need to warm up. This rule is very important and not to be ignored. Keeping the muscles warm will prevent injuries like muscle straining. If you train at home, you can warm up doing cardio. If you train in the gym, go on the treadmill for 3 to 5 minutes. Our cardiovascular system is getting warmed up and we're getting the heart rate up to 120 to 130 beats per minute. If axle loading exercises are not recommended for you, you can perform different types of exercises where the same muscle groups will be engaged. Those exercises are mainly performed laying or sitting down. If you have no conditions preventing you from doing axle loading exercises, I would still recommend wearing a back support belt anyway. It's better to avoid injury than to heal it. What are axle loading exercises anyway? Those are exercises where we're standing or sitting down while holding weights like dumbbells or a barbell, and that weight is in a vertical line with the spine. Even running is an example of a pretty intense axle loading exercise if we're landing heavily on our feet while increasing the speed. Axle loading exercises should be performed in slow motion, avoiding any jerk movements. At the time of this recording, I'm 7 months pregnant. And this is my second child. During both pregnancies, I've had a very active lifestyle. Except for the first trimester due to severe toxicosis and fatigue. The other 6 months of my pregnancy, I was physically active, with swimming, doing prenatal yoga and strength exercises, of course, with all the precautions for pregnancy. It kept my muscles toned. Yoga helped the flexibility of joints and ligaments of my pelvis. It helped to ease the labor process. Swimming also strengthened my muscles and joints, and it sure helped me stay in a good mood. Of course, the responsibility for you and your body is on you, and that's why I very much recommend consulting with your doctor. We're all different and unique, and what is completely fine for one person could be dangerous for another. While I will not insist on strength training while being pregnant, I believe that yoga and swimming are the safest forms of physical activity during pregnancy. Diastasis recti is very common after giving birth. Diastasis is a separation of abdominal muscles. How can you determine whether you have it or not? You can place your fingers onto your stomach and press your fingertips into your abdominal muscles, aiming for the middle. If you feel a gap, that's diastasis. And in that case, abdominal exercises are not recommended because muscles will settle in that position. Be patient and give it some time. A good alternative to crunches is an exercise called stomach vacuum. If you have myopia, certain types of physical activity is not recommended for you, such as any sport involving jumping, striking, punching, or any activity with the possibility of getting a head injury. That increases the risk of retinal detachment. Those limitations are placed not so much because of the diopters as much as they are there because of the changes in ocular fundus. People with low myopia, less than 3 diopters, can choose almost any type of sport they like. Also, in order to avoid trauma, it is better to start with light weights and gradually work your way up. Don't strain your body by starting with heavy weights. If you're new to the gym, start with weight stack machines. They are least likely to cause an injury. If you haven't worked out for a while, start light as well and gradually increase the weights. Running is not recommended for those who are overweight. Let's calculate your body mass index to see if running is recommended for you. BMI is calculated by this formula. Your weight in pounds divided by your height in inches squared and then multiplied by 703. For example, let's take my weight of 59 kilos or 130 pounds and my weight of 5'6" or 67 inches. I divide 130 by 67 squared and then times 703 and get a BMI of 20.3. Now use this formula for your measurements and let's see what we get. If your BMI is between 18.5 and 24.9, it falls in the normal weight category. If it falls between 25 and 29.9, it is classified as overweight. If it falls between 30 and 34.9, it is considered first-class obesity. Between 35 and 39.9, class 2 obesity. 40 and above, class 3 obesity. Running should be okay for those whose BMI is in class 1 obesity, as long as there are no other underlying health issues, but be very careful. For those whose BMI is in class 2 obesity, going to the gym should be fine. Walking, swimming, Pilates, calisthenics, cycling, maybe on a stationary bike are recommended as well. For those whose BMI falls in class 3 obesity, physical therapy is recommended in a supervised medical setting. While physical activity is allowed for those who have extra weight, there are a few rules that should be followed while working out. Avoid exercises with abrupt change of pace, high-intensity interval training with alternating bursts of speed, step aerobics, jumping. Add strength training to your cardio, so you can alternate cardio and strength workouts as long as you don't suffer from myopia or varicose veins. Running compresses our weight-bearing joints. The whole body weight is transferred from one foot onto another, putting stress on the joints. The higher the body mass, the more stress is added onto the muscular skeletal system. Another factor to consider is the tendency of overweight people to develop cardiovascular conditions. If waist circumference is greater than 32 inches for women and 36 inches for men, their risk of getting a cardiovascular condition is considered high. If the waist circumference is greater than 36 inches for women and 42 inches for men, the risk is considered very high. And if that's the case, cardio increases the risk even further, potentially leading to atherosclerosis or a heart attack. That's why for people whose BMI is high, it is better to avoid cardio and to substitute it with walking, swimming, or strength training. If you have any restricting health conditions or any concerns, or if you had any injuries or surgeries, please let me know in advance. Love yourselves and care for yourselves. That's the main rule here. So we looked into the safety guidelines for working out. Let's move on to the next video.